Good afternoon. My name is Bruce Parsons. I'm the Assistant Health Director for the City of El Paso Department of Public Health. Thank you all for coming this afternoon, especially on such short notice. We have the results for the Frank Macias Elementary School investigation that we'll be sharing this afternoon, and we'll also be talking about the halfway house situation, the investigation in Central El Paso. Let me just start by conveying what I conveyed to the parents at Frank Macias School when I met with the first group of parents who came in to have their children tested. I said to them, no parent wakes up in the morning and says, I'd like to have my child exposed to tuberculosis today. No parent does that. I certainly wouldn't want that for my children. I don't want that for their children either, except it's just the circumstance that we're in. So we did have an exposure, and the health department's obligated to follow up on that, do the appropriate investigation, get people tested, evaluated, and treated if necessary. Tuberculosis, I think most of you are familiar with tuberculosis as a disease from the Providence Hospital event and maybe other investigations that have occurred in the past. It is a treatable bacterial disease. It's important to note that it can be treated and treated very effectively. Generations ago, about all you could do was isolate sick people from well and hope the sick people got better and the well people didn't acquire tuberculosis. But now we have very effective therapies. It's spread by coming into contact and breathing in infected droplets when an active case, again an active case, not just someone whose blood test positive or skin test positive, a person has to have progressed to the point where they're active. And when an active case coughs on you over a prolonged period of time, you can acquire the infection. Again, it's important to note as a qualifying statement that children under the age of 10 rarely transmit tuberculosis. And Dr. Ocaranza, during his remarks, will be able to explain why that's the case, in contrast to adults where the typical transmission occurs, adult to adult or adult to child. There are 4 states in the country that have higher rates of international exchange of people and account for 51% of the TB cases. Those states being New York, California, Florida, and Texas. If you look within Texas and compare the El Paso experience to the national rates, you can see that the national rate of TB cases is low. When we look at numbers like 3 out of 100,000, that doesn't seem like very many. We have 3 out of 100,000 in the nation. Texas has a rate of 4.6, and our rate is 5.9 for the year 2013. So essentially, our rate of active TB cases in El Paso is roughly double the nation's, but is consistent, I might add, with other border communities. This is just a quick timeline on the Frank Macias investigation. We learned of an active case on June 15th. June 16th through the 18th, we identified with the school 171 possible exposed individuals, 163 of them students, 8 of them staff. We notified all the affected parents by certified letter, regular mail, and subsequent phone contact and even home visits of the possible exposure, and then encouraging them to bring their children to Frank Macias School for education and testing. That testing was conducted over the period of time of June 24th through July 2nd. All children that came to Frank Macias were tested. You'll learn in a couple of slides that some of them opted not to obtain that testing at the school. The results were shared with the parents. In the outcome of cohort number 1 investigation, and we call it number 1 because there will be a continuing investigation at Frank Macias Elementary School, which is going to involve a cohort number 2. The tested to date would be 149 students and 8 staff. Results to date, 120 negative, 35 positive, and 2 pending. There were 2 bloods drawn in the home late last week on Thursday, and those results are still pending. So they're not reflected in the positive or negative stats. That's a positivity rate of 22.6%, essentially 35 out of the 155 tested to date were positive, and that's how the rate's calculated. So we're at 22.6. You would expect, this is called a background rate, and it's important contextually to understand rates, especially in a border community, that a background rate ranges from 5 to 10%. What's meant by that is that in this community, if we looked at this room, if we went out to Walmart and just picked people at random, we would have a positivity rate on the blood or skin test of 5 to 10%. So that's in contrast to, again, a 22.6% rate, but it kind of establishes a foundation of what you could expect even in the absence of a TB investigation or a recent exposure. So that would translate into roughly 8 to 16 positives is what we would expect. We have positives in the neighborhood of 35. Students tested to date, 149. If you recall, 2 of those results are pending. Students not yet tested, 14. Unable to reach, 8. Going to the doctor, their own doctor for testing, 3 people. One child's out of town, and then 2 have opted to get their testing service while they're traveling elsewhere in the state. Probably one of the most important messages that we can convey today is to appeal to the parents of those 8 children who have yet to be tested to get their children tested. Our preference obviously would be that they come to our clinic or contact our staff so that those arrangements could be made for testing, but those children absolutely need to be tested. This is a serious situation. This was a serious exposure, and we need to know the outcome of those test results in order to determine what the next steps will be for those children and those families. So again, we encourage those 8 to contact the health department. We'll attempt to continue to contact them via home visits and phone calls and other means of communication, but certainly would like them to have the children tested. Next steps for testing. What we do with tuberculosis is go through a series of concentric circles, and if you look at the number 1, the green circle, that would represent the first cohort of investigation, which would be the individuals that had the greatest likelihood for a prolonged exposure to an index case. Once you get the results from that testing, that will guide you or steer you to look at other populations that may not have the same length of exposure, but may warrant or necessitate testing based on the results of the first analysis. So with a positivity rate of 22.6%, we obviously started looking at other populations that may be in need of testing. We identified those populations as cohort number 2, which would include the balance of the Frank Macias school staff. There are roughly 100 staff total, so we're talking about 90 or so that would still need to be evaluated. In addition, we're currently looking at additional students to be tested based on the length of exposure and the likelihood of exposure. That number is variable at this point. It could be as low as 20, it could be as high as 40. We'll have that determination made within the next day. Letters will be sent, again, certified mail. Letters will be sent to the home and regular mail to encourage those parents and staff to come in to Frank Macias School on Wednesday of this week in order to obtain more information about tuberculosis and to get bloods drawn for testing. It's, again, important to note that in addition to certified letters and regular mail letters, what we learned with the last mailing was a lot of people don't go to their mailboxes. They don't necessarily open their mail on a regular basis, that we have to use other means of conveying information and the necessity for testing to those parents. And certainly one of the things that we could get the assistance from the school on would be to notify those parents by their call process, where they can identify select phone numbers for the affected students and staff and notify them through a phone message. So the school is doing that in addition to our sending out those letters that I previously referenced. We hope to have the results communicated to parents and staff by the end of the week, at the latest the first of next week. And right now I would like to turn the rest of this portion of the announcement about Frank Macia's school over to Dr. Hector Ocaranza, who's our health authority, MD, and he will speak, and he's also a pediatrician, and he will speak to the next steps for the individuals that have been identified as positive, and then what treatment opportunities there will be. Dr. Ocaranza.
Thank you very much, and thank you again for coming. And as Mr. Parsons has said, tuberculosis investigations are long and they're difficult, basically because the time that lapses between we identified an index case and how we determine who is going to be tested and what individuals have been exposed to this index case. But for those positive individuals that we sent initial blood testing, we're going to send chest x-ray looking for signs of active tuberculosis. And also on those children or adults, we're going to send the sputum cultures, the ones that are possibly able to give the sputum. Children is very hard to get the sputum, and therefore we rely on the blood testing, we rely on the chest x-ray and also the physical exam to determine whether these children are having active tuberculosis. When we have a children with active tuberculosis, we need to look for an adult that is able to transmit the tuberculosis via the droplets, as we explained before, to other individuals, and also we look for other individuals in the household. That's what the concentric circles and the tuberculosis investigation, it is extensive and it takes a lot of time. Another thing that we have to remember, cultures for the bacteria of tuberculosis takes about 6 to 8 weeks to grow. So it's nothing that we put in the plates and it grows from one day to the other. It takes a lot of time. It's a slow growing bacteria. So it takes time before we know specifically if this is the tuberculosis bacteria and what antibiotics are going to be effective against the bacteria, the tuberculosis bacteria. For those that are positive with no signs of active tuberculosis, we're going to offer a specific treatment, which is the prophylactic treatment against tuberculosis. And we're going to explain to parents that this prophylactic treatment is a treatment to prevent the development of active tuberculosis in the future. We don't know how long it might take dormant this bacteria in the body of a child or an adult, but we don't want that to become active tuberculosis and become another case. So that's why we offer the prophylactic antibiotics. For those that we determine that have active tuberculosis, we're going to be offering the initial treatment with 4 medications, or we're going to take each individual case on a case-by-case basis to see what are, and tailor the treatment to that specific case. So we'll be happy to answer any questions.
Can we get your full name and spelling?
Sure. I'm Dr. Hector Ocaranza, O-C-A-R-A-N-Z-A, and I'm the health authority for the city and the county of El Paso.
Dr. Ocaranza, what does this mean for those 35 positives? What does it mean specifically for them now?
Well, initially, the blood test, we have to remind the people that having a blood test positive for tuberculosis doesn't mean that they have the active tuberculosis. What it means is that we need to man different steps in the investigation. We're going to send them for a chest x-ray. We're going to have them here for an evaluation and determine whether they have the active tuberculosis or not. We need to stress the parents not to be concerned that they already have the active disease. They may have been exposed before to the tuberculosis, and that's why they react positive to the blood test.
Any idea the percentages as you go forward? What's the likelihood of those 35 coming up, one that is TB?
Hopefully we don't find any active cases of TB, and that's what we're hoping, and we're going to offer definitely, if we determine that these are latent tuberculosis, we'll offer prophylactic treatment to all these individuals.
Any idea if we transmitted the TB?
No, and it's extremely difficult to say who transmitted the TB, because it could be, if we find somebody, as we said, if we have a child that is a sentinel case and we need to look around which one is the adult, but we don't have the capacity to determine specifically by genetic testing if it's the same bacteria that came from any other case. So we do have testing, and we do send some samples of the bacteria if we find an active tuberculosis to test to see if it's resistant to any of the most common antibiotics that we use. But we cannot tell where it's coming from. That's what the investigation expands in circles to find if there's any other individuals that are in close contact with that active case of tuberculosis.
Doctor, 35 personas son demasiadas que han dado resultados positivos. ¿Tiene algún conocimiento de cómo empezó a propagarse la enfermedad y qué es lo que tienen que hacer esas 35 personas en este momento?
Todavía no sabemos si esas 35 personas fueron expuestas nada más en un solo lugar o fueron expuestas en varios lugares. Es lo que tenemos que hacer de acuerdo a la investigación que estamos haciendo. Si este contacto fue nada más en la escuela, si fue en las casas. Muchas veces tenemos gentes en las casas, algún adulto mayor que está tosiendo, que a lo mejor fueron fumadores y que muchas de las veces vemos de que, bueno, a lo mejor está tosiendo porque fumó muchos años, a lo mejor está tosiendo por alguna otra razón y simplemente era de que también tenía tuberculosis y expusieron a todas las demás gentes en la casa. Entonces, un caso de tuberculosis se lleva muchísimo tiempo y mucho esfuerzo para poder saber si ese caso de tuberculosis ha propagado a otras gentes de la casa o a otros lugares, por ejemplo en las escuelas o en los lugares de trabajo. Pero esta tuberculosis, lo bueno es de que no se contagia fácilmente, no es como la influenza que estando en la misma oficina tosiendo, ya muchas de las gentes se contagiaron. Necesitamos una exposición prolongada y con un caso que tenga una tuberculosis activa y que esté propagando muchos bacilos en la saliva, en las partículas que
¿Cuál es el
tose.
tratamiento que deben de seguir?
El tratamiento cuando es una tuberculosis activa, son 4 antibióticos al mismo tiempo, o a veces necesitamos más, dependiendo si es resistente a alguno de los antibióticos o no. Si vamos a tratarlo de una manera profiláctica, tenemos que darle un antibiótico o 2 en otro tratamiento que ha sido aprobado recientemente.
Estas 35 personas, todas les va a tener que hacer los rayos X y que va a cubrir el pago de esos rayos X.
Bueno, el pago de los rayos X, el Departamento de Salud es el que va a pagar por el costo de los que no tengan aseguranza, y los que tengan aseguranza va a ir por medio de la aseguranza que ellos tengan.
¿Y el tratamiento, si es que alguno llega a dar positivo?
El tratamiento es a cargo del Departamento de Salud, y la evaluación médica también es a cargo del Departamento de Salud.
Can it be transmitted to family members? Like, what precautions do people need to take?
Well, if it's a small child, as we said, the small children cannot transmit TB. An adult is the one that is able to cough out the droplets and sneeze, and because of the lesions that we have in the lungs, those are the ones that expel the bacilli to other members of the household. That's why the members of the household are the ones that spend most of the time with an active case of tuberculosis. But when we find a child, we need to look for an adult.
If that's the case, could you tell us how many of those 35 are adults and how many are children?
Yes.
Of the 35, 29 are children and 6 are adults. That translates into roughly a 20% positivity rate for the children and 75% for the adults.
This may sound strange, but the more concern here is the adults, not the children, because they can't transmit it.
Certainly we have concern for the children should they go on to develop active tuberculosis. But when you think in terms of the role of public health, it's to protect the greater public. And so the threat of children relative to adults is dramatically lower as far as risk to the public is concerned. It has to do with their personal circumstance, and we want to get them on prophylactic meds, preventive medication if necessary, and if they're active cases, obviously the medication for treatment. To protect them. It's not just about protecting the greater body public out there, it's about protecting them as well.
What's your message to parents about waiting for symptoms before they bring these 8 children that haven't been contacted to get tested?
Well, the message that we're going to convey to those parents that we haven't found is bring them for testing. Once they have symptoms, it might be an advanced stage of the disease, and it might be an active case of tuberculosis instead of being a latent tuberculosis. So if you know anybody that knows these people that have failed to come, just invite them to come and get tested. We want to give out the message and invite those that haven't been tested to come and get tested.
Do they run any risk for not being tested if they do have the?
Yes, if they were exposed and they don't get prophylactic treatment and they never get tested, they can be an active case of tuberculosis. And tuberculosis, if it's left untreated, can be deadly, and that's our concern.
Are you guys still trying to reach this family?
We're still trying very actively to reach these families, and that's why we ask for the help of you guys, the media, to relay this message and be partners in all this investigation like you've always been.
How long will you know if the case is active? And you said it was 6 to 8 weeks?
Well, 6 to 8 weeks it takes for the bacilli to grow in a culture media. Once we have an active case of tuberculosis, it means that we test the sputum, it shows bacilli, it means that it is infectious, and by the time that we get the culture, it might take 6 weeks, but a person can have a negative sputum but come back with a culture that is positive 6 to 8 weeks. So that's what the difficult in making the diagnosis in an earlier time.
And who picks up the cost of the testing? Does the school district pay for that?
So far, we've not had those discussions with the school district. Ultimately, the public health department is responsible for communicable disease investigation and control. I think most of you recall that in the Providence situation, Providence Hospital made a substantial contribution toward covering that cost. That is something that we wouldn't necessarily charge them to do. They were willing to do it, and we graciously accepted the offer. But at the end of the day, it is public health's responsibility to investigate and control disease.
Is that the same thing for the halfway house as well?
We'll get to that in a second. We want to get all questions related to the school. If you guys have any more questions, please ask them now. We'll move on to the second investigation.
I have a quick question. So Carroll Welch is where the Macy's Summer School campus is going on. Is there any testing for the students or staff there that might have been possibly exposed to people? Is there anything in the works?
Thank you for the question. What's happening is that we're rolling out the investigation based on our assessment of the children who are at greatest risk as well as adults. And if you recall from the positivity rate among the staff tested, then it would be logical both from the standpoint of that positivity rate to expand the testing group, the cohort 2, to all of the adults in the school. And again, that relates not only to likelihood of conversion, but also, the threat to the general public, because the threat to the general public would be greater with an adult with active tuberculosis versus a child. So you will expand those rings as needed, the concentric circles.
Any other questions related to the school investigation?
Doctor, si nos puede clarificar, son 35 resultados activos, 35 resultados positivos de tuberculosis, sin embargo la enfermedad no está activa. Si nos puede clarificar esto y el riesgo que tiene que un adulto es más probable que pueda transmitir la enfermedad a comparación de un niño.
Claro que sí. Los 35 que salieron positivos no significa que tengan la enfermedad activa, significa que han estado expuestos al bacilo de la tuberculosis y se necesitan hacer más pruebas para determinar si tienen la enfermedad activa. La diferencia es de que en la enfermedad activa hay bacilos que se están multiplicando y puede ser contagioso, sobre todo cuando es un adulto. En un niño no lo consideramos que sea infeccioso para otras personas, más que nada porque no pueden propagar las partículas de saliva o de flema al exterior de la misma fuerza y de la misma manera que un adulto.
¿Hay un segundo grupo de personas que se va a iniciar también a examinar próximamente?
Sí, el segundo grupo, que es el siguiente círculo, el círculo número 2, que vamos a iniciar la investigación, se le van a hacer pruebas de sangre también a todos ellos para determinar el riesgo que han tenido de exposición a esto.
Hasta el momento los 35 que ya tienen, todos tuvieron examen de sangre nada más, también del de la piel.
No, de examen de sangre. En esta optamos por hacer el examen de la sangre para eliminar un poco la variable de la positividad de la prueba de la piel. La prueba de la piel puede salir positiva muchísimos más casos y tendríamos que hacer la prueba de sangre. Entonces optamos por hacer la prueba de sangre para eliminar ese factor en este rompecabezas, si lo podemos llamar así.
¿Y de estos 35 cuántos son adultos y cuántos menores?
How many adults and minors of the 35 positive?
For 29 would be children and then 6 adults.
29 niños y 6 adultos.
Y hay 2 casos pendientes, ¿correcto? Todavía se está tratando de localizar a las personas.
De localizar a las personas que no hemos encontrado, me parece que son 8. De esas 8 que no hemos encontrado, estamos activamente buscándolos y le hemos pedido la ayuda a ustedes, a los medios de comunicación, para que se presenten y nos den oportunidad de hacerle las pruebas a los niños que faltan.
Are there any questions related to the school before we move on? All right, Nurse, if you want to move on to the next topic.
I think it's important for all of us to realize, as was referenced earlier, that TB, tuberculosis, is with us. And one of the things that a local public health department does is investigate reports of possible exposure, go into work sites, go into other settings, including schools and halfway houses, to evaluate staff, residents, students for exposure to TB. That's the normal course of our business. I think what makes this situation unusual is that it's coming right on the heels of a comparably sized investigation with a school. So in a matter of a couple of weeks, we have a large-scale investigation at an elementary school and then another investigation at a halfway house, and the numbers are roughly comparable. We learned of an active case on June 24th of an individual that was likely infectious. That individual was associated with a central El Paso halfway house. We then worked with the staff, the director and staff of the halfway house, to identify 178 possibly exposed residents and staff, 146 residents and 32 staff. We then made arrangements with the facility to deploy our staff and all of their equipment to the halfway house to do the testing, the actual blood draws on site. Today, July 6th, we drew bloods from staff and residents. Those bloods will be forwarded to the state lab in Austin for analysis. It's the same test that we can do locally, but given the load that we've had with the Frank Macias school investigation, we opted to use the Austin lab, the State Health Department lab, in order to expedite getting the results, the specimens process, and getting the results back. This is the status as of a little after 4 p.m. today. Tested today 139 residents, 36 staff, for a total of 175. Results aren't yet available, as you would expect, because the specimens, again, have to be prepped and processed, shipped to the Austin lab, and then they will notify us of the results, positive or negative, on the QFTs. Positivity rate obviously not available either. Again, trying to frame this in the context of an expected background rate, you would expect, because we're a border community, that we would have this 5 to 10% naturally occurring positivity rate for either the skin test or QFT, which would mean that we would expect somewhere, again, between 8 and maybe 18 or so who would be positive, kind of irrespective of the exposure. So again, we're talking about cohort 1, because cohort 1, again, we're talking about an adult population. So depending upon the test results from the first investigation, first round of testing, we may have to go into work sites, we may have to go into homes if there are active TB cases that are identified through the process. So far, we've tested 175. That leaves 7. Those remaining 7 we expect to be able to test at the health department. Again, results are expected by the end of this week by using the state lab. Positive results will be communicated in person to both staff and residents of the facility. Negative results will communicate by phone. Questions?
So again, we won't have time for one-on-one, so any questions regarding this second investigation, we ask that you make them.
Why was it easier again to test? Because they're all together?
Yes, it's much easier to conduct an investigation in an employment setting where all the employees are there every day, or in a situation like this where the residents do spend the night, so they're there in the morning, depending upon their work shifts. They'll be there sometime during the course of the day and evening. In contrast to a school setting, especially a school setting where you just started summer break and people disperse, they go all over the place to visit relatives, friends, and so on. So it's much harder in a summer break situation doing a school investigation than it would be in a situation like this where you bring in a team, you get everybody, and in a matter of a day, as you could see, we were able to get blood draws on 175 people. That's just because of the nature of the setting. Yes.
Will the families of the employees also be tested, or is it just employees?
Again, this would be a cohort number one, because you would look at the results of this particular testing and then determine what course of action to take. If we end up finding active cases in either the resident or the staff population, then interviewing and testing of household contacts would be warranted, yes.
Si nos pudieran decir la misma información en español, cómo es que es más sencillo en este lugar y también por qué decidieron mandar los otros exámenes a base.
Sí, la investigación en este tipo de establecimientos, si podemos llamarles así, es muchísimo más fácil porque tenemos a todos los residentes y a los empleados en un mismo lugar a la misma hora. Entonces nuestros empleados del Departamento de Salud fueron a ese lugar, recabaron las muestras de sangre y esperamos tener los resultados al final de esta semana. Mandamos las pruebas de sangre al laboratorio estatal en Austin, más que nada porque habíamos alcanzado nuestra máxima capacidad en el laboratorio local, y en Austin nos van a ayudar con este tipo de pruebas. Otra vez esperamos tener una prevalencia de positivos entre 8 y 10, between 8 and 10%, right? We expect that we're going to have a positivity rate. Entonces, basado en la prevalencia que tenemos en la ciudad y la experiencia que hay en el estado, es lo que esperamos tener de positivos. Ojalá que no tengamos ningún caso de tuberculosis activa en todos estos residentes, con excepción del caso índice que tenemos en este local.
¿Cuándo se iniciaron los exámenes médicos para estas personas?
When did we test all the people at the halfway house? When? Today. Ahora los hicimos todas las pruebas de sangre, de los números que mostramos hace un momento.
¿Y hasta cuándo esperaríamos por los resultados?
A final de esta semana, como habíamos mencionado, a final de esta semana posiblemente tendremos los resultados de las pruebas de sangre, y basados en esas pruebas de sangre vemos si tenemos que expandir la investigación a otros círculos.
I have some questions about the halfway house. Do you know when the report of tuberculosis came in to your guys' office, or when you were made aware of that?
This is the timeline.
Nice job. Yes, it was June 24th.
I don't know if you were aware. This is the presentation and the timeline.
Are you guys asking those who are possibly exposed to change the way that they interact with family or friends that they may come in contact with?
Well, not at the present time, until we know that we know that latent tuberculosis cannot be transmitted to other people. So until we know that we have an active case of tuberculosis, that's when we put them on respiratory isolation, and that's when we tell them the way that they need to interact with the household members, and also we will be testing the household members.
And just to add to what Dr. Ocaranja just said, if you think in terms of what are the classical symptoms of TB, of an active TB case, there would be fatigue, rapid weight loss, and significant weight loss, and then with pulmonary TB, very active coughing. So you would expect that if somebody had those symptoms, exhibited all of those symptoms, then there would be a greater likelihood in a situation like this of conversion.
Is coughing a blood symptom?
Well, it could end up being a coughing up of blood. It wouldn't necessarily have to be in order to transmit.
Yes, and definitely coughing up blood is one of the symptoms of pulmonary tuberculosis. But weight loss, prolonged fevers, especially nocturnal fevers, night sweats, cough, even if it's not with blood, can be a sign of tuberculosis, but not every single cough that is a short-term cough is going to be considered tuberculosis.
Because we talked with a mother whose son is at the halfway house. He's experiencing some of those symptoms, including coughing up blood.
then definitely this investigation is going to be useful, because coughing up blood, there's many etiologies and many causes of coughing up blood, but tuberculosis is one of them.
Ok. Doctor, esta investigación, los exámenes que están haciendo en esta casa, ustedes tienen conocimiento de esta situación desde hace 2 semanas, por lo menos, y hasta el día de hoy se está dando a conocer, por lo menos públicamente, lo que se está realizando. ¿Hay algunos otros lugares en los que en este momento se esté llevando a cabo las mismas investigaciones y que hasta este momento nosotros no sepamos y dentro de 2 semanas nos vamos a enterar?
No, estas son las investigaciones más grandes que tenemos. Siempre tenemos casos de tuberculosis activa que estamos investigando, pero los más grandes son los que les damos a conocer a ustedes. Y en mi conocimiento no tenemos ninguna otra investigación grande que estemos realizando. Estas 2 son las únicas que estamos en este momento. Pero cabe recordar y quiero enfatizar, siempre tenemos casos de tuberculosis activas, y esos casos individuales de tuberculosis activas realizamos la misma investigación pero a una menor escala.
You guys good? Any more questions?
Are members of the halfway house, are they required to be tested for tuberculosis before they live at the halfway house? That's what residents were telling us today.
I'm not aware of that. Once they come into the halfway house, I'm not aware that they're required, but before they step into the halfway house, they are being tested.
Can you tell us how the report came to your guys' department? Did it come from the halfway house or an individual?
Under Texas law, all notifiable conditions, those would be communicable diseases, need to be reported by a variety of healthcare providers, and that could include doctors, nursing homes, could include hospitals. In this particular case, this was a report from an area hospital.
Any more questions, guys? Again, we thank you guys for bearing with us on the time crunch that we had here, but we thank you guys for joining us. And if you guys could please help us reach out to those 8 families, individuals that we still need testing on the first investigation, we would greatly appreciate it. Thank you guys.
Thank you.